Hi everyone, this is Shalli Kumar again from Osce Nurse Training Cambridge. I'm an experienced Osce Nurse trainer for the NMC Osce exam in UK and also the lead trainer for Osce Nurse Training Cambridge. Welcome back to my another video on my YouTube channel. So if you like my videos, please press the like button now and subscribe to my channel. It gives me a lot of motivation to keep making more videos for you to help you to revise for your NMC Osce exam. So today's video, very interesting one. So we are going to look at insertion of suppository. Okay, it's one of the clinical skills you've been asking me to do for a while. So I'm going to do it today and tell you what are the most common fails in this station and how you can not make those mistakes. Okay, so I'm going to tell you 5 top common fails, and alongside every fail I will tell you how to not make that mistake. Okay, my top tip. So let's have a look then. So insertion of suppository is one of your clinical skills. It's a 10-minute station and you have to you be given a drug chart to work with. Okay, or some kind of prescription. So because it's a drug, you need to give it as per prescription. So you will have a prescription in the form of a drug chart. And so your job is to administer the suppository as per prescription. Okay, so that's what you need to do in 10 minutes. So let's have a look what have been the common fails in last few months on this station. The first one is did not check ID and allergy band against prescription chart. Now it might seem very simple, but it's a very common one still in exam, because we know for some of the clinical skills your examiner tells you that the pre-checks have been done. So this is a common thing, isn't it? They tell you ID check, allergy check is done, pre-checks have been done, all your equipment is clean. But then you start assuming it for every station. But it's not true for this station. Examiner is never going to tell you that because you're giving a medication. So identifying your patient correctly and identifying their allergy correctly is one of the most important things you need to do as per drug administration principles to before you can give a medication. Okay, so you make sure that you ask the patient their name, date of birth, check that against their ID band, and check against the correct page of the prescription, which I'm showing you is the page 2, as you can see on your screen. Also check their hospital number. Patient doesn't know the hospital number, but it's written on the ID band. Check that against your drug chart and check that in your documentation. Okay, and look at the drug ID band and look at the drug chart, the matches, and verbalize that. Ask for them allergy. What are they allergic to? Ask for allergy status. Check that it's written correctly on their red band on their wrist, and then check that against your prescription. And also ask for the reaction of allergy. That's very important, and check that against your drug chart. So that might not be, reaction might not be written on their red band, but the allergy will be written, but it would still definitely be instilled in your reaction, would still be written, documented in your drug chart. So check that and ask the patient. Next one is did not check the legibility and validity for prescribed medication. So that's really important. You're giving a drug, so you have to have a legible and valid prescription for that. So if you do not, I know they're going to give you a legible valid prescription, but if you haven't checked that, that would still be a critical fail. Like, so no assumption, you need to go ahead and check the validity and read the validity. Make sure you check and read everything for the prescription for that drug. So it could be prescribed as once only. In this case, like on the screen, is prescribed as required. So you know you got the name of your suppository, you got the dose, you got the date. You haven't got the duration and end date, start date, because it's as required, but you have got prescriber signature and bleep number, so it's a valid prescription for as required, so that's fine. So make sure you read everything and verbalize. Moving on to the next one, did not verbalize correct position for inserting suppository. So I know in exam the mannequin is already placed. For health and safety reason, they place the mannequin in the correct position for inserting suppository because they do not want you to hurt yourself moving mannequin. So it's already placed. But then you can assume that because it's already placed, I don't need to say. No, that would be a critical fail. You still need to tell the examiner the position, talk to the mannequin, your patient, and just say, I will assist my patient into left lateral position. And the positioning, full explanation is given in your marking criteria. What is left lateral position? Patient needs to lie on the left hand side, knees need to be bent, and the feet can stay on the same level or slightly raised, and the patient bottom should be brought out to the edge of the bed, okay, for you to make it easy to insert the suppository. So that's what left lateral position is, but it's written in your marking criteria, so know it very well and verbalize that you will assist your patient in that position and explain what it is, okay. So number 4, did not give correct instruction to the patient post insertion. So there are certain things you need to tell the patient post insertion of suppository. First thing is, they need, if they can tolerate it, they should lie down for 20 minutes, and also there might be some discharge as the medication is melting in the rectum. So those are all the things you need to tell. It's in your marking criteria. So if you don't say, that would be a fail, okay. So it's important, and also covering your patient, maintaining privacy and dignity is really important as well. So if you don't do that after insertion, that would be a critical fail as well. Again, if you're giving it for constipation, you need to tell the patient to press the bell when they're ready to go to the toilet, so you can help them. So that's really, really important. So that has been a very common fail for the exam, missing any of those points, okay. Moving on to the next one, did not complete the documentation correctly for administration. So that's a big one and a very common one. If you're given a medication, you need to complete it correctly on your medication chart. So say we given it as required, so you need to make sure for as required you add the time, because the time slots will not be there for as required, because it's only as required. So what is the time you're giving, which is front of your chart. The front of your chart where the scenario is written tells you, assume this is the date and time. If he says today, it means your exam date, and say time says 10 o'clock, then it's 10 o'clock. If it's different time, that's the time you're giving. So for example, if it's 10 o'clock, I will complete today. Under the time one, I put 10 o'clock. Then under today, you will add your signature, and then you will add the date. Don't write today, write the exact date, which will be your day/month/year, okay. So in that format. So make sure you're doing all this correctly, okay, because it is a simple station, it is, but it's still a medication station. You need to adhere to, stick to all the drug administration principles, and by doing this, you're showing the examiner that you're a safe practitioner and safely can give a drug, okay. So don't take it lightly. Just make sure you know everything in your marking criteria. So that's the way to do it for the suppository. I hope you like the video, and if you do like the video, please press the like button now and subscribe to my channel. Also, you can visit us on our Google review page and see what other nurses have been saying about our training. So it might make it easier for you to make that decision, where do you want to take training for your NMC Osce. We provide training for both online and face-to-face, or the combination of the two if you like that better and it fits your needs better. And also we provide training for adult Osce and pediatric. So if you would like further information, you can go on oscenurstraining.com, our website, or email us for more information on oscenurstraining@outlook.com. I will soon be back with another video for you. For the time being, make sure you're revising well and keeping well, so you can pass your exam first time. So hopefully I will see you soon. Bye for now.